Welcome everyone to today's Inside St Vincent's webinar discussing organ donation. Thanks so much for joining us, and I just want to introduce myself. I'm David Factor, I'm from St Vincent's Hospital, and today is really about conversations. It's so apt that this webinar involves a group of esteemed panellists who we will have the privilege to converse with in the next hour. Why I say it's about conversations is because Donate Life Week is, in many respects, a perfect time for all of us to be talking with our loved ones about organ and tissue donation. And I really want to encourage all of you to come forward with any questions you have throughout this webinar, and I'll pose them to our panellists as we go along. But to be frank, I'm embarrassed to admit that I had no idea before reading up about this topic in the last few days about the rarity of actual organ donation, from the point of view that only 2% of those who die in hospital are actually eligible to donate their organs. So the importance of the family and their role in confirming their loved ones' organ donation wishes cannot be overstated. Today, we will be discussing not only the importance of this conversation, but the practicalities around it. In light of the rarity of organ donation, we can safely say that donated organs are an extraordinarily precious gift. Precious not only because of their scarcity, but precious because of the transformative role they play in giving new life. Few hospitals in the world have been able to better utilise these precious donated hearts and lungs than St Vincent's. Today, we will have the opportunity to discuss some of the pioneering work that the St Vincent's Heart-Lung Transplant Unit have been able to undertake, particularly in relation to mechanical devices, but also the heart-lung, the heart in a box, the organ care system that no doubt many of you are familiar with. So through that heart in a box technology and through some of the other pioneering work, we've seen year on year record numbers of heart-lung transplantations undertaken by the unit, and we'll touch on that. But of course, none of this pioneering work would be possible without the support and the work, the tireless work of the St Vincent's Curran Foundation. From day one, the foundation has been there alongside us at St Vincent's, lockstep, supporting us in every aspect of our endeavours. So thank you for the support. So let's meet our panellists and let's start the conversation. And first of all, to my far right is Dr. Paul Jantz, who no doubt many of you are familiar with. Paul is a cardiothoracic surgeon, but he's also the director of our heart-lung transplant unit. Thank you, Paul, for joining us. Next to Paul is Dr. Sahil Al-Sufi, and Dr. Sufi is an intensivist, an intensive care specialist, but he's also the hospital's medical specialist for organ and tissue donation. Nikki Glenister is someone that I've long known, and many of you no doubt would be familiar with as the nurse manager of our intensive care unit here at St Vincent's Hospital. But today Nikki's here in a very unique way, and Nikki has made the decision to join us for this conversation in light of her experience following the passing in recent years of her son Alex. And I really want to thank you, Nikki, for joining us for this today. And right next to me is Jayden Cummins. And Jayden's like my twin, really. I mean, we were born in the same year, in 1971. We both have a son, an adolescent son called Henry. But unfortunately for me, that's where the similarities stop, because Jayden is blessed with a rare energy that I have never seen the likes of before. He is passionate, he's an inspiration, and believe it or not, he had a heart transplant only last year, and really is an inspiration to all of us. So thank you, Jayden, for joining us. And with your blessing, I might actually start with you. And just ask you to tell us your story, both pre and post transplant.
Gosh, thank you so much for having me here. I feel honoured to be on this panel. My story, look, up until the age of 46, which was only 3 years ago, was not that unique. Typical Aussie guy. I was a single dad at that point. And late 2017, I contracted the flu, just normal flu type A. Didn't think too much of it at the time. Went to the pharmacy to pick up some Codral cold and flu. Pharmacist remarked that I didn't look too well. Went and saw my GP. The GP saw that I was in a state of rapid atrial fibrillation, which is an arrhythmic beat. So packed up to RPA, and again, so my heart was, I had an irregular beat, but it was nothing that was kind of, they were too worried about at that stage. They decided they were going to treat it pharmaceutically. And I had a cardioversion that was booked in, which is where they kind of jumpstart and try and get you back into a sinus rhythm. So I went about business as usual, but started to really deteriorate quickly. My organs started to struggle, and I started to struggle to breathe. Went back to the hospital. I'd had a couple of cardioversions as well, but they had all failed to put me back into that sinus rhythm. So, but I was ready. I was packed up. I had my boots on. I had the cannula out after the sixth cardioversion attempt, and but I was complaining about this pain in my chest and that I couldn't breathe. So they decided, just for observation, to keep me in overnight, and within 2 days I was on Ecmo, which is essentially a very, it's kind of the last resort of life support. It's been described to me, highly invasive. So at that point in time, that just gave my body a rest, and they put me into an induced coma. So obviously the shock, it all happened fairly quickly. I went into the hospital, with my boy to, get jump started, but essentially just with the flu. Within 2 days, I was in a coma. One of the best things that happened on that day was that they started a dialogue with St Vincent's, and you guys agreed to take me in. So I was delivered very carefully to St Vincent's, and then a plan was put together in terms of how they treat me. At that point in time, there was still a lot of complications, and it was unsure of which way I was going to go. But they decided they were going to roll the dice and try fitting me with an LVAD, the left ventricular assist device, which was just the most incredible machine. I call it an artificial heart. It just took over the job, and I apologise to the people that know all of this already. But with lots and lots of complications along the way, that artificial heart kicked in. I woke up from my coma about 2.5 weeks later, in a different hospital, not being able to move, with a battery-operated heart, trying to take it all in. But my trajectory changed from that point on. So I enjoyed my time on the LVAD. It gave me the strength and the ability to be able to, get my strength back, get my fitness back. There was lots of discussions around different things also at that point in time, but essentially I waited for 436 days on that, with that heart, being a cyborg essentially. And I got the magical call last year, as you said, to say that there was a heart available. And I've never looked back. I feel so blessed and so grateful and so healthy, apart from a little bit of COVID weight. I'm the luckiest man alive, so very, very grateful to be here.
And can I ask, just you referred to the 436 days that you were waiting.
Yes.
What was going through your mind? What were some of your anxieties about the donation process and so forth? Just because I know we've got a lot of patients who are watching on today.
It's funny that my anxieties were all around the donation process, not around the surgery. I was blessed, and we are blessed in this country. Obviously I'm St Vincent's, so we've got the world's best physicians and the world's best heart and lung clinic on our doorstep. So as far as the physical aspect of getting the transplant, there was no anxieties whatsoever, and I can say that hand on heart. All of my anxieties were around the donation process. I underestimated the emotional toll that it would take. they prepare you for it. There's a lot of psychological testing, and there's a lot of build-up, you know, to even get onto the list to begin with. You know, there are so few of these precious organs that they're not going to waste one. And they want to make sure that, you know, if you've got to the list, you know, and there might be a lot of people watching this that are on the list and are feeling that trepidation, but to get to the list is such an achievement. You know, to be able to be, you know, to have that rare shot at getting a new organ is just incredible. I was acutely aware of what had to happen for me to get that call. And it's a dichotomy. You're living with this every single day. You're jumping at shadows a little bit. Every time the phone rings, your heart is in your mouth. I didn't feel guilty about requiring a heart, and I knew people used to tell me all the time, it's not your fault, you're not, it's, you know, it's the circle, all these beautiful things, and I get it. What I felt guilty about was going to bed every single night hoping that it happened tomorrow, and the payoff and what that meant, what the implications of that emotionally. People talk about survivor guilt and all sorts of things. I don't know what the term is, but knowing that morning that I got the call, I still play it out today. You know, that again, that dichotomy that, you know, you're in this situation and you make that phone call and you're so excited that you've got this chance of having a life. You know, I had the chance of seeing my boy grow up, and all of these, you're flooded with emotions of gratitude and, oh, thank God. And at exactly the same time, you know that in another ICU waiting room somewhere, at exactly the same moment, caused by this single event, there is another family having the worst day of their lives. And that's a heavy burden to carry. So, you know, the morning I got the call, we were well aware of that. I was surrounded, you know, with my family, my son and my sister and her husband, and we sat and we celebrated this chance. And again, we know you're not going in to get the tonsils out. It's a big operation. We said our goodbyes. I'd written a letter to my boy for surgery. I'd also written a letter if I didn't wake up. You know, these are, you know, it's hard conversations, but we also took a moment and we thought about the donor and what that family was going through. And it's still a struggle. I'll never completely fathom what that gift means, ever.
Nikki, if you don't mind, on that note, I might throw to you if that's okay. And look, I've long known you as the nurse manager of ICU. We've had a lot to do with each other over the years. But I hope you don't mind if I kind of cut to the chase and ask you, I know you wanted to be here today, you suggested it. Why did you want to be part of this conversation today?
Maybe I'll just tell you a little bit about what happened to me and the fact that I've been a nurse manager for 25 years here in ICU. Well, sorry, I've been in the ICU for 25 years. And, you know, I'm very pro the donation service and the process, and also the transplantation part of the side of the unit. So I have that additional information that other people may not have. I never thought that with my knowledge of the whole process and the recipients and transplantation, that I would also become a member of the donor family. Approximately, I have two beautiful sons, and the youngest was a risk taker, charismatic, cheeky, loving, caring boy, and Alex. And 2.5 years ago, he suffered a tragic accident straight out of the blue, and unfortunately, after resuscitation and two days in the children's ICU at Prince of Wales, he was declared brain dead. I was already aware the 2 days before that was going to be the likely outcome, but for my other son and my husband, who are not medical or connected, they were completely unaware of that. I think the reason I felt very strongly towards becoming giving permission for Alex to donate his organs, and that was very important to me. And my husband, who was quite squeamish and, doesn't like to talk about death or anything throughout the time I've known him. I knew that was going to be a difficult call for him to agree to that. I think what I had done previously, why I wanted to come to talk to you, ironically, is that because of my work, I had had a conversation with both my boys about a year previously to that. My husband, if you talk about death at home, what happens if I die, blah, 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 he doesn't want to talk about it. But I thought it was important, knowing what I know, that I had the conversation with my teenage boys. And Alex would have been 12 at the time, and my other son a bit older. And I remember coming home and saying, "Hey boys, Dad won't like me talking about this, but I saw a moment and I want to talk to you about my wishes if something ever happened to me, and hopefully it won't, and etc." So we just had this casual conversation at home, and I said, "Oh well, I need you to know this. This are my wishes." And Alex was the first one to chirp up, "Hey, if something happens to me, I won't need them. Someone else should have them." And my older son was a little bit more like his father, or I don't know about that, and reserved his judgment at the time. But I never realised, a year later I would be in that position where as a family, we had to make that decision. And so it was very obvious to me. And when we had the conversation as a family, my son remembered what Alex had said, and as a consequence, also Alex, my husband, also agreed, it made the process so much easier. It was a terrible time for our family. It still is, and you don't move on, but you learn to cope a little better each day. But the importance of being able to know that, and Alex would be very, very proud to know that he didn't die completely in vain, and that he's helped 4 other people have a better life, saving their lives potentially. And it's quite amazing, and the whole process was, it was very, I experienced it at work, but to be part of that process as well and have the support of the donation nurse specialist, the bereavement coordinators. It just didn't end at the time that he went for donation, but that's been continuing on for the last 2.5 years, the support that I've received.
I'm sure Alex would also be very proud to know that his mum right now is having this conversation and conveying what his wishes were as well. If you don't mind, I was just going to ask you, what was the process on the night? Are you able to talk us through what actually how it works?
Absolutely, and I actually was very aware of the process, and obviously, but I had to I didn't have to educate, but I had to bring my own family along with me, and they had to be aware. So as soon as I made my wishes, I had spoken to the consultant, knowing that Alex had been declared, or was very likely at that point, to become brain dead, had brain death. So I discussed that one-on-one with the consultant, paediatrician, intensivist there, and then I asked him if he would speak to my husband and son initially to explain about Alex's condition, which he did, and then we involved straight away once we'd made the decision. The donor nurse specialist was called in, and she came to see us as a family. I mean, the social worker at the Prince of Wales Children's Hospital is just amazing, and also together with the donation nurse specialist, we were very, very much cared for. And I wasn't strong enough at that point in time. I was being told I'm a mum, not a num, because I was trying to do my usual thing, like trying to sort of make sure everybody else was all right. So they took over the process of supporting my family as well, so I didn't have that responsibility for the process. But everything was explained, even though I know it inside out. It was explained to me again, and there was a time set for the donation, which gave us another 12 to 24 hours with Alex, and to say goodbye. And we actually accompanied him into the theatre. And the process after was that he came back to the intensive care there, and we were able to spend some time with him after the donation. So, and they're just an amazing group of people there.
Nikki, one thing that it sounds like you were fortunate with was the fact that you had the conversation.
Yes.
And you had in Alex someone who had a very clear take and shared his view. You mentioned he's a vivacious young man, and you had a frank and open conversation prior. And I also heard you mention about awkwardness as well, and no doubt there's a lot of awkwardness and stigma in the community about having that conversation. But what would you like to see throughout the community? What changes do you think we can make to have a better understanding amongst one another, and certainly within our family and among our loved ones?
Yeah, I certainly have a message, and the message is that, you know, throughout my time as a nursing unit manager, nurse manager in ICU, children cope a lot better than adults think with death and illness, and it's often the adults that are worried about talking to the children or bringing children in to see their very sick relatives. But I've noticed that they cope a lot better over the years. And they're very matter of fact, and they ask questions, they ask those awkward questions, and they want to climb on the bed and they want to do that, and that's great. And that doesn't matter what age they are. But what I think is really important is how I found with my children is that they're pretty resilient, you know, they're pretty open, they say it as it is, they don't beat around the bush. And I think it's the parents or the families that are more worried about bringing up the subject of death with their children, or the possibility of. So I've been a bit of a pain in the neck since then, and you know, I've been talking to the Director of Nursing of the Organ and Donor Tissue Donation Service, and Emma, and you know, about trying to get into the schools, trying to get into the high schools, having a little seminar with the kids in high schools. They're of an age where they start to understand, and they will hopefully then take, hey, Mum, Dad, guess what we talked about today at school? You know, we had this. They will bring up the conversation with their family. And I think we need the teenagers, the young men and women in schools to actually take it home and have that conversation and start. And then hopefully the parents who perhaps, you know, are worried about, you know, how to bring up the subject, have it brought up for them, and they can discuss it as a family.
Out of interest, Jayden, you know, I mentioned your teenage son, Henry. What have you've had conversations, no doubt, about the organ donation side with him. What was his comfort, if you don't mind me asking, you know, in terms of that? Do you concur with Nikki about that agility and resilience that kids tend to have about having straightforward
absolutely. I mean, obviously being on a recipient side, you know, he's incredibly biased about the subject. He supports it wholeheartedly. But you know, going back to when I was at my sickest, and there was, you know, a lot of question whether I'd survive. And you know, he was 13 at that point, and being told by people close to him, including his mum, that I was probably not going to make it. And you know, there you've got the 13-year-old holding my hand on life support, and he was the one that said, "You've got this, Dad. You're not going to, you're going to be okay." He had more strength than I could possibly hope to have in my little finger, so I 100% agree that you don't want to indoctrinate this thing, but it's about courage, and he knows that my donor was a hero. He's saved my life and other lives, and that is not lost on him. He knows how important that is, and I also agree with the sentiment, getting out and talking to schools and not making this a taboo subject. A lot of adults struggle to talk about this, but the kids are okay with it. It's a part of life, and it's a beautiful part of life. I mean, it's the most precious gift that one person can give to another, and it's the beautiful thing about organ donation is that it transcends colour and race and creed and class and gender. It shows everything that is pure and wonderful about humanity. And oh my God, we need that in society at the moment, don't we? So what a message to be sending. And as far as my Henry is concerned, I wish there was another way that I could have purveyed that message, but he gets it loud and clear. He's stronger about the subject than I ever will be.
Yeah, it's amazing that. So Hel, if you don't mind, I'd love to hear, I mentioned at the outset that you're obviously an intensivist. You probably work alongside Nikki in our ICU, but you're also our organ and tissue donation specialist in the hospital. Obviously, you've been involved at pretty particularly traumatic times in some patients' lives and their families' lives. And I was just going to ask if you could talk through that process of how that process works and how that conversation works in that situation, if that's okay.
Thank you, David. Thanks for asking that. And I just wanted also to thank you before answering your question. Big thanks to Nikki and Jayden for really sharing the very personal experience and insight, and I find it very inspiring, even having been working in that space for a while. We work as a team in intensive care. We consider organ and tissue donation as being part of end-of-life care. In fact, we think we provide best end-of-life care by offering organ donation and tissue donation when it's appropriate. We meet families and at very different difficult circumstances, very stressful times, and we have always, to consider this before we raise organ donation with families who are at the brink of losing a loved one, and we a team of members who are very trained, have specific training that prepares us to provide end-of-life care. It involves nurses, doctors, and allied health, including pastoral care and social work. So it's not that a single person would really drive this process, and it comes naturally, I think, from the scope of practice of the intensive care specialists, and it's only really in the last 10-15 years that it has become a bit more specialized. I think doctors have become very good in considering organ and tissue donation when it's appropriate. It hasn't been always the case. We raise organ donation when we believe a patient has died while being on a breathing machine or will pass away after coming off, when it's been agreed amongst the doctors and the family that ongoing aggressive treatment with life support would be overly burdensome, and only then organ donation would be raised with the families. We rely on patients' wishes. We have an opt-in system in Australia, and that requires patients to register their wish. And we know when Australians register their wish to become an organ donor, should the occasion arise, that families overwhelmingly agree and support the organ donation process. More than 90% of families upheld the consent, a wish of their loved one. But too often we see families who just don't know what their family member would like to happen just because they didn't have the conversation. And as you said before, it is quite awkward to talk about it. We'd like to look away. I'm guilty of the same. But it doesn't take long. These are inspiring conversations that we can have with our friends and families and colleagues. And if we share our preferences either way, then our families in a very difficult time are not left on their own to decide what is the right thing to do. We as a team guide the patients' families through this process and support them. It is a lot to take on, of course, if a patient passes away or is at the end of a curative treatment in ICU. There's a lot of things to take on. Patients' families have a great burden to carry, and we don't want to increase that burden by with a discussion about organ donation. But when the patient's families know what their loved one would like to happen, it's much easier for them, and of course also for us to support these families.
So that very supportive experience that Nikki described, what you're saying is that's really the standard practice of that very multidisciplinary, very well thought out process.
Yes. Occasion opportunity, if I might say, doesn't arise often. You mentioned it before, only 2% of patients in hospital die in circumstances and where we can offer organ donation to families. And as I said, doctors have become relatively good now in considering organ donation and providing the information to families to make that decision. Nikki pointed out before that it took 1 or 2 days to really guide families in general and through this process, sometimes even longer. It's time that can be used and it's well used by allowing families to be at the bedside of their loved ones, and during which we provide the information that's required, and where we work then closely with Dr. Jantz and his team to find a patient on a waiting list. And there are still about 1,600 patients on a waiting list desperately waiting for life-changing or life-saving offer, a donation. About 10,000 of patients on dialysis waiting for an organ or hoping for won't even make it on the transplant list. And so that time is then spent in assessing which organs would be possibly helpful to these patients and to find a potential recipient who could benefit from that donation.
So maybe on that note, Paul, if it's okay with you, I might ask you just, if you can, just to talk through what that process is, how it works in terms of aligning the organs that have been donated with the transplant process, if you're able to talk us through that.
And thank you for having me here today. And as Sue said, I'd just like to thank these two, Nikki and Jayden, for what they've allowed us into. I've known Nikki for a long time, 25 years, maybe even longer. And she's spent the first 5 years of that time teaching me ICU, and then we work together every day and in the hustle and bustle of the unit. So we know each other very well, and Jayden, we know Jayden inside out, literally. So and he's a brave guy, and these guys are the heroes, not us. So thank you. And the process on the night, you've probably heard how it sort of pans out, but from our point of view, we have very little to do with donors other than obviously knowing certain characteristics that we need to know to align that donor with the recipients. And there's a set of criteria, as you can imagine, blood group and height and weight and those sort of things that we have to take into consideration. And then the utilitarian side of the recipient waiting list, who's going to benefit the most from those organs, and they can be difficult decisions, and how long people have been on waiting lists and just how sick people are. We have some people that are very, very sick, and they will be what we call urgently listed. So there's an agreement made around the country that they should get the next available heart because they're not going to see the week out, for instance, or the next available lungs. And we have a range of technologies that can help us sort of keep people alive and well on the waiting list while they're waiting for the transplant. So it's a lengthy process. It takes 24 to 48 hours from getting that initial phone call and going through that process before you actually embark on the actual transplant. So, yeah.
I saw you on Channel 9 News the other day. The story was about how your unit, the heart-lung transplant unit, despite the pandemic, in the face of the pandemic, were able to achieve a record number of heart-lung transplants for the year. And you paid tribute to the tenacity and hard work of the transplant unit and the researchers as well. But do you mind sharing with our audience the process and who's involved and so forth? Because sometimes we just take it for granted and just think it's the surgical team, but I know that there's a huge amount of people involved.
Enormous amount of people and logistic people. It starts with a phone call. Well, if we look at Jayden, it starts with Jayden having, essentially a cardiac arrest in RPA and a team from St Vincent's going and picking him up on Ecmo. And there's a technology that we didn't really have 5 to 10 years ago, but through the help of the Curran Foundation, those sort of people, we've been able to establish Ecmo Retrieval program so that we can go and bring Jayden back, and we can bring him and give him over to Sue and Nikki to stabilise him and get things into a situation where we can go on and put in an LVAD. And that's another program that we didn't have prior to to maybe 10, 15 years ago to the strength that we have it now. But the actual night starts with a coordinator calling us and giving us some information on where that donor is. And then from a surgical point of view, there's about 20 or 30 people that are mobilised for the theatres. So you need a team that needs to go out to where the donor is, and that team needs to get into the police car. So the police are involved, so they'll take us to wherever that donor may be, or they'll put us on a plane. And over 50% of St Vincent's donations come from interstate, so we have to get on planes and fly. And for 30 years, those planes have been given to us by the Packer family. Initially, we go in Kerry's plane, and then as it grew, the Packer family would actually pay for our transport interstate. So those sort of enormous philanthropic gifts have kept the program going. And then you have a donor team at the hospital where the donor is, and then you have 2 surgical teams back at St Vincent. So there's a huge team of people put together. And most of it is logistics and organisation, and we just stand there. We're like the fullbacks. We just get the ball at the end and score the try. So we're very lucky. But there's an enormous team of nurses and coordinators and perfusionists and intensivists and anaesthetists all working together to make it happen. It's amazing that it happens. And as we speak, there's a lung transplant going on at the moment. So it's a wonderful exercise in what teams can do and what people can do.
You would have heard me at the outset talking about the preciousness of the organs that we receive and their scarcity. And I made mention of the fact that no unit throughout the world better exemplifies that precious utilisation, or maximising the utilisation of those organs that we receive. I'd imagine there's a lot of pioneering technology that we've been involved with over the years, and I was just hoping if you could just talk through some of those specifics to explain why are you able to utilise more organs than other units throughout the world? What's the point of difference?
Well, we have some good people here working, trying to push that envelope. the Victor Chang Institute and all the research supported by the Curran Foundation and people like Peter McDonald and who are driving innovation forward. So Australia is a big country, and there's only an organ will only survive outside a body for a certain amount of time. And so let's say for hearts it's 4 hours, 4 to 6 hours, and for lungs it's a bit longer. They're a little bit more resilient. So Australia being a big country, we're already pushing the envelope when we do transplants prior to these new technologies. So if we were to go to Brisbane or Townsville or Darwin or Perth even, those ischemic times, which is the time that the organ is outside of the body, are very long. And the longer that is, the harder the transplant is to succeed. So we've over the years really pushed the envelope. When we talk internationally to units in Europe and America, for instance, they're always slightly in awe of our ischemic times and our results. So, but what's happened over the last couple of years is the development of the organ care system. So now we can put organs on machines, and you referred to them as the heart in the box or the lung in the box. So that will not make that ischemic time indefinite, but it can certainly prolong it. And so that sort of technology, in many ways was pioneered here in St Vincent's. We were the first to do a DCD heart transplant using a organ care system. So that's a heart that has already stopped working, and we reanimate it. So that was first done here in St Vincent's, and that's hugely increased our ability to procure organs, 30 to 40%. So hence we're in a year where we're doing a lot of transplants, to your earlier point. So that sort of technology is supported by many of the people that are watching this, the philanthropic donations, like the mechanical hearts. And so Jayden's an end user of all of that, and it's just wonderful to see him sitting here and to know that he's going to, play cricket with his son in the nets. That's what you do it for, and for people watching, that's the end result, some little guy's got his dad, and it's as simple as that.
And would it be fair to say, aside from the research breakthroughs that are taking place on this campus, the skill and tenacity of the staff is the third component in terms of enablers? Is it that philanthropic support? Am I overstating that, or is that? No,
not at all. Not at all. I mean, I'm a very small part of an amazing team, and the theatre staff are incredible at St Vincent's. The nurses in theatre, I've never come across a group of people like them. And then you deliver this patient who, as you probably gleaned from Jayden's story, who are on death's door. You deliver them to Nikki and her group, and look over to Sue and say, away you go. And they spend minute by minute for hours and days on end looking after these patients to get them through. So it really is a very unique unit, and it's been honed by the fact that we're constantly pushing the envelope, and that feeds down into all our other work, into our cardiothoracic work. We're able to push that forward because we're doing great things and in the transplant field. So, it's the space program of cardiothoracic surgery. I think transplantation, it's where all the breakthroughs seem to happen. And that feeds down into our routine work, which is also cutting edge in many ways with robots and minimally invasive surgery. So we're all imbued with that sort of sense of wanting to do more and do it better. And as I said, we're just the little tiny pointy end of that team,
I must say, 19 years ago or so, when I went for my job interview to come and work at St Vincent's, and I was down in Melbourne at their transplant unit, but I must say, when the interviewer asked me, what do you know about St Vincent's Hospital, and that I should have done more research, but that was the one thing that I knew, this campus, among other things, which I know it is, but certainly what came to mind was the pioneering work of the transplant unit from the Harry Windsor days through to Victor Chang and through to the innovations now. If you're all okay, I might throw to some questions from our audience. Okay, can I still be a donor if I'm a smoker, a drinker, or overweight, or have a disease or have cancer? If I can't donate blood, can I still be an organ donor? Sahil, do you mind?
Yes, I might take that question. Thanks for asking that. I think many families, ask that and are surprised, and when we raise organ donation and make a family aware that a patient in our unit, their loved one, could help others with an organ donation, and they say, oh, but he was a terrible smoker or had high blood pressure. And it's incredible over the last 10, 15 years what advances have been made. And the short answer is yes, even if you're a smoker, have high blood pressure, diabetes, it is possible to donate. It, of course, warrants a careful assessment at that point of time, but it certainly doesn't rule out that organ donation could proceed as it is, when it is appropriate, yes. And I think that's really a recent development, and it's really very much driven by transplant physicians and surgeons as well. Blood-borne virus infections, including hepatitis B and hepatitis C, which was clearly not, wouldn't allow organ donation to go ahead 10 years ago. Nowadays, even patients who have a hepatitis B or C infection are considered for organ donation, yes. So by all means, if you consider registration for organ donation, don't hold back just because you're a smoker or have high blood pressure.
And maybe in a way that goes back to our point about the importance of having a conversation, not just to know your loved one's intent, but also to overcome a lot of the misconceptions. And I think only by talking about it do we get a better picture and overcome a lot of those.
That is right, yes.
Right, okay. This one's in a nice big font for me. Do you think Australia will move to an opt-out system? Sahil, it looks like I've got to pick on you again.
Good. Speaking of moves, really, opt-in, opt-out, and it's, I think, amongst even specialists and donation specialists, a lot of confusion about that. Short answer is there's no evidence that the opt-out system is better than the opt-in. It has been introduced in many countries worldwide, and some it has been associated with the rise of organ donation, in others it hasn't. I think it's good practice in Australia that we put the family central to discussions and about organ donation, and that I think should not change. All families are at the center, crucial to the donation process, will always be asked about their wishes. We should not assume that a patient wants to be an organ donor or does not want to be an organ donor. We need to ask the patient, and if the patient can't respond and communicate his wish or hasn't registered, then the family needs to know about the wish. And I think that is what fits with the Australian setting and society, and not to assume that all patients want to be an organ donor. Many do. The actually great majority of Australians want to help others if they can with an organ donation, but they need to be asked, and that requires a dialogue, conversation amongst the family, and then with us to find out how you as a person have decided.
Yeah, I think it's important to understand that the families have to agree to it.
Yeah.
Irrespective of what an individual decides they want to do, the families on the night have to agree.
Yeah.
And so hence the conversation is important.
Absolutely. All right. What kind of follow-up support were you offered as a donor family? Can you make contact with the recipients? Nikki, are you comfortable to answer?
Yes. I was offered a lot of support. So I touched on earlier about the support during the process, but it doesn't stop there. So after the donation, and during our bereavement and our grieving process, the New South Wales Organ and Tissue Donation Service and the team were in close communications with us, not only just looking after our welfare, and also updating us on the progress of the transplantations. You probably don't understand how important, unless you've been there, that you want the transplantations to be a success. And I can kind of imagine, at the moment we've been very lucky, and 2.5 years on, I'm getting updates from the from the recipients, via the New South Wales Organ and Tissue Donation Service, of the welfare of the recipients, and so far so good. They're all surviving. However, I can't imagine how it feels, and it'd be another blow on top of our own bereavement if it wasn't successful. So when Paul talks about the new technology making the survival of the organs better all the time, that's so important to the donor family. And it's not only the fact that that it's important that for me that Alex's organs save somebody are successful. It's also knowing that he's still helped those other 4 people in our circumstance, in our experience. I would love to be able to contact those people, find out a lot more about them. There are obviously some anonymity rules around that for good reasons. I guess that would be my wish, to go and meet everybody and give them all a hug and tell them about my son. There is a way of communicating, but I can write to the recipient families, and likewise they could write to me, but they do it via the Organ and Tissue Donation Service, and that's entirely up to them. I haven't done that option. I think I will in the future, of making that communication, and I have heard from one of the recipient families, but it's quite general.
Right.
Yeah.
Right. But it's almost like a legacy type of situation, isn't it? That connection and having that ongoing realization as life continues for you, to have that connection, I guess.
Absolutely, yeah. Definitely.
Alrighty, I think we've run out of time for more questions, I'm afraid. But one of my jobs is to thank now, in concluding, all of the panellists for being here. And normally that's quite a standard process. This is something very different, because really, from the bottom of my heart, and no doubt all of the audience today, I've never been part of a panel where the panellists have been so straightforward and upfront and candid in sharing really personally their experiences and being so straightforward. And you know what, that in many ways is the theme of today, about starting that conversation. So thank you for being such exemplars in that. I really want to thank all of you on that front. But I also want to thank the St Vincent's Curran Foundation. I've mentioned, Paul's mentioned, all of us have really mentioned the point of difference, the enabler role that the St Vincent's Curran Foundation has always, from the word go. From the point of Fiona Coote having her transplant onwards, we have always benefited from the St Vincent's Curran Foundation. I understand, Paul, that very much continues to be
Absolutely.
the case, particularly with the heart and lung in a box work that you're leading the way internationally on. So thank you to the St Vincent's Curran Foundation, and thank you for organising today's webinar. Just one thing I do want to touch on, as it is Donate Life Week. St Vincent's is a proud supporter of Donate Life Week and the drive to encourage people to register. As a world-leading transplant centre, we are in a unique and privileged position to have provided thousands of people needing heart-lung transplantations, and we've seen this firsthand today. But what I want to make very clear in concluding is that despite the majority of Australians saying they support organ donation, only 1 in 3 are actually registered. Registering is easy and it takes less than 1 minute. So, if you're clear on your decision, I encourage you to register online at Donate Life and have at least one conversation about organ and tissue donation this week with your loved ones. We've seen firsthand what a difference that has made, and I really encourage you all to do so. On that note, again, thank you all for joining us, and thank you, our audience, for being with us today. This is a special day for this campus. Thank you.